Good morning, I'm Maddie Jansen, and this is the podcast of 17 News at Sunrise. It's everything you need to know to start your day in about 15 minutes.
Working in the spirit of the Golden Empire, this is 17 News at Sunrise.
Good morning. Right now at 5, as more cases are reported in Kern County, we're learning more about where they are. And just last night, we learned a resident of Brookdale Senior Living has tested positive. What a spokesperson for the facility has to say.
A local whiskey maker shifts gears to produce a brand new product, for him at least, and one that's hard to come by these days. Hand sanitizer. We'll take you inside Dead Horse Distillery coming up.
And a local doctor shares her perspective from the front lines, why she hasn't been able to see her daughter in more than 2 weeks, and what she wants the entire community to know on this Thursday, April 2nd, 2020. Good morning. Good to have you with us. I'm Maddie Jansen, coming to you live here from my home in Tehachapi, trying something completely different this morning as we move more and more people out of our newsroom.
Absolutely. You know, we talk about the importance of social distancing, and doctors say as much as possible is essential. Even if you can't do it, all day long. I mean, for every minute that you practice social distancing, it does go a long way. And so, again, we are trying something new, and hopefully it's going to work out. So just bear with us as we try to iron out some of the kinks here. But again, this is kind of our new normal for the next several weeks.
Yeah, and so many people are dealing with the same thing.
Absolutely. All right, let's turn things over now to Kevin Charette, who has a look at your forecast. He is also at home, but he's got some good news in the weather department. Good morning, Kev.
Good morning. Yeah, we're all making little adjustments here as we go throughout the morning, but yesterday we hit 73 degrees in Bakersfield. Normally we should be right around 71 this time of year, and our record of 88 was set back in 2011. As we take a look at the satellite and radar right now, you can see we've got the clear skies. We're looking at a great day all around Kern County, starting out at 48 in Bakersfield, a northwest wind at 5 right now, so a little bit of a chill in the air. And then as we take a look at the hour by hour, you can see we will be in the upper 60s this afternoon. Take a look at Tehachapi, 37 right now, a west wind at 15 miles per hour. And as we take a look at the day here, we are going to be looking at a wind advisory, and this is now extended until Friday at 7 a.m. And then as we take a look at the hour-by-hour forecast for the Tehachapi area, you can see temperatures expected into the lower 50s this afternoon. I'll have much more on your forecast that's coming up in just a little bit.
All right, Kev, thanks so much. It is 5:03 now, and once again, confirmed cases of coronavirus spiked in Kern County. There were 28 new cases yesterday. That's the biggest jump in cases since testing started in Kern. Now, 129 people have tested positive. At least 7 of these cases led to people being hospitalized. More than 2,100 people have tested negative. Nearly 1,400 people are waiting to get their results. Public health officials have not said if anyone has recovered. Now that the number of cases has surpassed 100, Public Health released some more specific data about the patients who tested positive. Nearly half of the positive tests are people between the ages of 18 and 49. And we still see most of the confirmed cases coming out of the western half of Kern County. There are 92 cases in the Bakersfield area. There are 27 in the Valley region, 2 in the mountains, and 5 in the desert.
We're also learning more about what some of those cases of COVID-19 here in Kern County look like. Yesterday, we learned that a member of the Brookdale Senior Living Facility community has tested positive for the virus. A spokesperson for the facility tells 17 News it's in contact with the member's family, other residents' families, and staff at Brookdale. The person who was infected has not been identified. Brookdale says it is monitoring residents and associates for signs and symptoms of COVID-19 and working with county health officials and following local and CDC guidelines to combat the disease.
A grocery store chain confirms employees at 2 of its stores have tested positive for COVID-19. One of the positive employees works at the Albertsons on White Lane and Gosford Road in Bakersfield. That employee is now getting medical care, and Albertson says they may ask other employees to self-quarantine for 2 weeks. The company says the infected person has not been to work there since March 23rd. Albertsons also confirmed yesterday an employee of the store on Panama Lane has also tested positive for coronavirus. The associate hasn't been to work since March 23rd. A spokesperson says both Albertsons stores will remain open. Adding staff members have been cleaning, sanitizing, and disinfecting the stores on a routine basis. A major farming company may also have an employee with the virus. We received a copy of a letter sent to workers at Grimway Farms informing them a Grimway employee tested positive for COVID-19. We contacted Grimway for comment and were told the company would not comment due to HIPAA laws protecting patient health information. A Grimway spokesperson says the company has taken decisive action to reduce the potential for exposure to COVID-19.
And testing has really picked up around Kern County. As you know, we've been telling you there are several sites you can go to get testing if you need it, but they do urge you to call ahead first. A lot of the pre-screening will happen over the phone. Here's a list. Priority Urgent Care says all of its buildings test for COVID-19. Accelerated Urgent Care is also testing at its Southwest location at Coffee and Stockdale. Omni Health will test for coronavirus, and local hospitals are testing as well. Dignity Health offers a free online checkup for people with milder symptoms. And a reminder, you'll only be tested if you're showing symptoms. So again, call first, and that's very important because a lot of the pre-screening, again, will happen over the phone. And here's a look at some of the symptoms of coronavirus and how they differ from the flu and allergies. The most common symptoms of the coronavirus include fever, a dry cough, fatigue, and difficulty breathing. Less common symptoms include aches and pains, sore throat, runny, stuffy nose, and diarrhea. Remember, you may be sick with the virus, though, for up to 2 weeks before developing symptoms. Keep in mind, flu symptoms are similar, but muscle and joint pain, a runny nose, and headache will be more common for the flu. And a lot of people have allergies right now. Those symptoms include sneezing, coughing, a runny or stuffy nose, and itchy eyes. And it's important to note that you should not be touching your face because that's how viruses like COVID-19 and the flu can spread. Again, if you think you have symptoms of the coronavirus, call ahead to one of those testing sites or your primary care doctor.
As the coronavirus pandemic sweeps across the nation, people are encouraged to stay inside to help flatten the curve, but some people are still going out. We want to know what you have to say. So we're asking this morning, do you think people should be cited and fined for not social distancing? There are several ways for you to vote. You can call or text 661-888-4617. Press 1 for yes. Press 2 for no. You can also visit our social media pages where we have a link there where you can click the link and vote. We'll have some of the results coming up in about 30 minutes.
Well, the Kern County Superintendent of Schools office says it will comply with the governor's order to close schools for the remainder of the academic year.
So what does this look like for your children? 17's Vanessa Dillon with a look at the online learning system your child could end up using very soon.
The Kern County Superintendent of Schools office says they have one goal in mind as they transition county students over to online learning, and that's maintaining the rigor of a normal classroom setting while also establishing an easy-to-use platform for both teachers and their students to stay connected during this time of distant learning.
Welcome to week 1.
Online learning might not be every parent's first choice, but with changes forced on by the COVID-19 pandemic, we all may need to embrace a new normal.
We wanted to create a one-stop shop and within a user-friendly platform that would not intimidate, but that would allow administrators and teachers to connect with their students.
The Kern County Superintendent of Schools office has already made strides in the right direction, rolling out what could end up being the online learning platform your children may soon rely on in the upcoming months.
It gives you kind of a synopsis of what the student should expect.
We really are trying to support students in continuing their education. We weren't looking for a Band-Aid, right? We know that in Kern County, our kids have some time to make up. We need to catch up on a good day, right? And we don't have the ability to lose traction during this time of school closure.
Canvas is an online learning platform that gives educators the resources to create a dynamic, interactive teaching experience, allowing them to stay connected with their students, all in a virtual classroom setting.
What I think most people are missing right now, what most students are missing right now, is the normalcy of the routine of school. When do I do my math? I know that I listen to my teacher talk for a few minutes and give instructions. I do some group work. I go into my individual assignment. There's some routine and normalcy that brings comfort to the content. This models that because they know exactly what they're supposed to do, and it has a pattern to it.
The team spearheading the initiative says the online learning tool is equipped to translate into 33 different languages. It's used by thousands of universities and colleges across the country and provides free access to over 190,000 students in 47 school districts across the county.
We truly believe that gives teachers the ability right now to focus on community, to focus on those pieces of collaboration and connection with their kids, because we know our Kern County kids are missing their teachers and they're missing that connection.
The office says they plan to roll the new learning curriculum out in phases, hoping to launch the program by April 13th.
On the accessibility check.
Vanessa Dillon, 17 News.
And although I think this looks beautiful, what it's telling me is this.
Community Action Partnership of Kern is hosting an emergency food distribution event today in Shafter. The drive-through giveaway will take place in the parking lot of Truth Church at 11 a.m. That's located at 101 Beach Avenue. Organizers say you can enter through the alley from Pine Street behind Peter's Funeral Home. Cap K says it will distribute 1 box per vehicle and will not allow walk-ups at the event. Also, Cap K is asking people to not show up before 10 a.m. as to not block traffic in the area.
All right, well, we'll still to come this morning on Sunrise, from whiskey to hand sanitizer.
Yeah, quite a change for a local distillery. 17's Taylor Schaub shares the story of how this local whiskey maker is determined to help in this crisis.
Welcome back. KGET is teaming up with Adventist Health Bakersfield to highlight the many inspiring stories in our community. Lives are transformed every day by people in our community who care, taking action to better the lives of others. As residents around Kern County scour store shelves looking for hand sanitizer, one local whiskey distiller is making his own and donating it to those in need. 17's Taylor Schaub has more.
Good morning, Alex. And after his distillery grand opening got delayed due to the COVID-19 outbreak, one Kern County resident decided to convert his shop in order to support a very crucial shortage. Mark Green's been making whiskey since he was a kid growing up in Kentucky.
It's in my blood. It's what I was raised doing.
For 4 generations, his family's been handcrafting barrels of his great-granddad's recipe. Now he's filling those containers with hand sanitizer.
Works awesome. It's been a little crazy, a lot of late hours. I mean, you have to use a totally different kind of products than what you do making whiskey.
For the past week, Green's been like a mad scientist in a laboratory, converting his distillery into what looks like a Purell factory.
Right at about 145 or 150. I mean, this place is it's a mess.
Toiling from sunrise to sundown to donate these essential cleaning supplies to those in need.
Probably, I'm going to say, a couple of 1,000 gallons.
Glenn Ephraim with Gleaner's Food Bank is one of the beneficiaries.
It means the world to us. Some of these items, they just wouldn't have access to if it wasn't for generous community donors like Mark.
Green says that's what his great-granddad would have done.
I know they would approve because they were the same way. They always helped people out. Cheers.
So while this southerner may look rough on the exterior, he's actually smoother than a glass of the good stuff and sweeter than a bottle of his salted caramel-flavored liqueur.
We've got to help people. You know, we just, this is a big, small community, and we wanted to help everybody out as much as we could.
Alex, that's such a great story. And along with Gleaners, Green will also be giving away hand sanitizer to the Bakersfield Homeless Shelter, the Mission at Kern, and the Boys and Girls Club here in Bakersfield. And he's also giving away 6 free ounces of hand sanitizer for every bottle of whiskey he sells to that customer. In Southwest Bakersfield, Taylor Schaub, 17 News.
All right, Taylor, thanks so much.
Love that story. It's 5:24 now. Well, as we're all asked to stay home to do our part amidst this pandemic, healthcare workers don't have that luxury. Most are working longer days than ever on the front lines of this crisis. 17 News wants to thank the doctors and nurses and other medical professionals for their sacrifices and share some of their experiences. I spoke last night to Dr. Kieran Lowen, who is the medical director for Priority Urgent Care. Her husband is an ER doctor. She's worked the last 20 days straight and hasn't seen her daughter in more than 2 weeks except via FaceTime because they don't want to risk exposing her to the virus.
And it's been a good 2 weeks plus at this point. It's hard. It's so hard. And there's not a day that goes by that I don't just want to grab her and hug her and kiss her. And it's so hard not to as a mom. Being a doctor is probably one of the hardest things right now. And that's where he and I had this discussion last night of, okay, what do we do if you do get infected? And what do we do if you do end up intubated? And what do we do if you don't make it? And that's probably one of the hardest discussions I've had to have with my husband. And it's something that we want the community to know, that we providers are seriously thinking about this kind of stuff. And we want to make sure that everybody knows that it's not something that we're taking lightly. There's a reason why we sound like we're trying to be overprotective or overcautious. And it's because we see what's coming down the pipeline.